Hey everyone, it's Mark the Mental Health Therapist back with another one of my videos. Today we're going to be talking about something that's really popular in the psychology field right now. We're going to be talking about resilience. As always, let's talk about what resilience means in the first place. Resilience is our ability to resist the long-lasting psychological and emotional effects of trauma or chronic stress, or any other event that has a significant impact on our mental and physical and emotional well-being. The kinds of things that resilience protects us from is the development of things like anxiety and depression or other disorders like that. Also, it can help us avoid things like post-traumatic stress disorder or PTSD. It can prevent us from getting involved in drug or alcohol addiction after a trauma. It can help protect us from changes in our moods or in our personality after trauma. And it can also protect us from having future relationship problems as a result of the things that we experience. Our ability to be resilient is based on a lot of different things. There are genetic factors from birth. There is our overall personality, and that can affect our resilience. There are experiences we had growing up and the kind of caregivers we had, whether they were supportive or neglectful, as well as the other supports in our life who played a role in raising us and continuing to support us even as adults. Resilience can also be increased with active intervention, whether as a child or as an adult, through things that we can do or change in our lives. There are a couple of really important things to think about before we launch into how to increase our resilience. And these are the different factors that affect our ability to be resilient at any given time. We have protective factors and we have risk factors. Now, protective factors are those factors that make a person more resilient, whereas risk factors are the things that make a person less resilient. Protective factors include having parents or caregivers who are loving, nurturing, supportive, and protective of us. Also, having a really strong community, whether that's friends or family, religious community, cultural community, a community of people who are interested in the same things as you. Either way, that's a protective factor. Also, your access to education and healthcare are important protective factors. A strong sense of identity and confidence, patience, seeing challenges as opportunities rather than problems, and other things that go along with that. Risk factors include having abusive, negligent, or even just absent parents. Also, lacking any supportive people in your life is a huge risk factor. Also, having a weak sense of your identity, of who you truly are and what you truly value. Having low self-esteem and low confidence. Problems with social skills or making friendships. If you had a recent loss, like a recent death in your family and you're still grieving, or current drug and alcohol abuse or addiction. So basically, your resilience right at this moment is a combination of your genetics, your personality, your protective factors, and your risk factors. So some parts of your resilience are completely out of your control. You can't control your genetics, you can't control the things that happened to you in the past, and in many circumstances, you can't necessarily control your personality. So basically, what does that leave you? Essentially, you have to look at your protective factors and your risk factors, and these are the things that you can start making changes in. So I'm going to give you some examples of what you can do to start increasing your resilience. Now, it's important to remember that this is a process. It's not something that will just happen in a snap of your fingers like that. It's going to take time and it's going to take effort. But with the right people around you and doing the right things, you can become more resilient. There are two really important pieces to increasing resilience, and arguably these are the hardest ones to actually accomplish. The first one is to remove yourself from the environment that's still causing you harm, whether that's leaving home, whether that's moving out of your community. Sometimes that even means leaving your province or country. Either way, taking yourself out of the environment that keeps causing you harm is hugely important. The second really important piece to increasing resilience is creating a supportive community. So if you've never had a supportive community around, friends or family or colleagues or religious or cultural community, then that is the next step to increasing your resilience. Find people who truly care about you and who you can trust, and who will support you when things get bad, as well as celebrate you when things are good. So these two steps are the biggest, most important ones, so I'm going to repeat them. Taking yourself out of the environment that's causing you harm, and creating a supportive community. Other things you can do to increase your resilience that are a little smaller in scope and can be done faster include finding opportunities for success, even if they're small things. Find things that you can do and that you can do well to increase your sense of confidence and self-esteem. Also, improve your physical health. Start eating better, get a bit of exercise, practice meditation or yoga or whatever it is you do for relaxation. You can also do things like quit smoking, quit drinking alcohol, or severely reduce your drinking of alcohol, quit doing drugs, that sort of thing too. All contribute to improved resiliency. Going to therapy, talking to someone like me, who could teach you to work through your trauma and build coping skills for negative emotions and for traumatic memories. Create a routine that's stable and predictable for you, something that you can feel good about and know what to expect day to day. And also creating long-term goals and working towards them. Think about what you want your future to be in 5 years, and then start working towards that future if you can, with small, regular steps. Thanks everyone for watching another one of my videos. I really appreciate all the time that you take to listen to what I have to say and hopefully learn something. Just remember that when it comes to resilience, it's a process. It takes time. You have to be patient for things to change and turn around for you. Just work at it step by step, small piece by small piece, and you'll find that when negative things happen to you, when stress feels overwhelming, you'll be able to manage it better and to come out of it better on the other end. I look forward to seeing all you folks again in the next video. Take care.